Welcome to Christian Leadership Institute of Minnesota, Kenya campus. We are at Kitagel, Jesus the Springs of Healing Sanctuary campus. I'm your teacher, Patrick Marindai, a counseling psychologist. Today, we are going to study or to learn on group counseling, and then we'll brainstorm on the stages of counseling and steps in counseling. So as I said, CLIMB is an initial, meaning Christian Leadership Institute of Minnesota and beyond. This is a university, an accredited university in the United States, but it has an extension program to Africa and other nations. And here in Kenya, we have our college at Kahawa Sukari, headed by our able director, country director, and he's also the African director, Bishop Cosmas Salamba. So welcome. We talked about counseling, what counseling is and what counseling is not. And today we want to brainstorm on group counseling and the definition of group counseling according to George Gassner, 1978. He said that group work refers to the dynamic interactions between collections of individuals. Dynamic interaction between collections of individuals for prevention or remediation. Dynamic interaction between collections of individuals for prevention or remediation of difficulties or for the enhancement of personal growth or enrichment through the interactions of those who meet together for a commonly agreed on purpose and at prearranged times. I repeat again, because of those who are writing. Dynamic interaction between collections of individuals for prevention or remediation of difficulties or for the enhancement of personal growth or enrichment through the interactions of those who meet together for a commonly agreed on purpose and at prearranged times. So group work is when we meet a group of people who comes together, or counselees who come together for a common goal. Maybe they come up with an issue that needs to be addressed, and it is within the counseling setup. It is not just any other group like a church setup or where people just meet to make stories. It is a place where it is prearranged and it has its own laid down procedures on how to conduct it. What is the purpose of a group counseling? 1, to increase clients' knowledge of themselves and others. 2, help clients clarify changes they want in life. 3, provide members tools they need for making and improving changes. Provide members tools they need for making and improving changes according to Corey and Corey, 2006. Provide members tools they need for making and improving changes. That's in bracket, Corey and Corey, 2006. 4, is effective for a variety of groups, e.g. substance abuse clients, loss and grief clients, among others. Is effective for a variety of groups. You can add even marriage counseling where there are groups of spouses who comes together. The group counseling environment that is number 5, the group counseling environment can give clients a chance to air out their views in a structured social settings. The group counseling environment can give clients a chance to air out their views in a structured social settings. It helps in expressing painful emotions in a supportive group of people with similar experiences. So the purpose of group counseling is where main reason actually is for purpose of information, giving information on the part of the counselor. You remember last time we said that a counselor is an informed helping practice or practitioner who have a lot of knowledge, and your work is to impact knowledge on the people that you counsel. We don't give advice. We said in counseling you don't give advice. In counseling you don't give direction, but you give information so that the client, because it's client-led, the client can choose from a variety of knowledge and can come up with their own decisions on what they need to do. So in a group setup is whereby people express their emotions, they express what they are going through, and you brainstorm together with them on the way on how to come up with the best solution or the best way forward. There are ethical guidelines with groups, and the ethical guidelines with groups is that we need to have something called screening. Screening for appropriateness for group counseling. So there need to be some sort of screening when people come or before you start a group. You cannot just have a group counseling, or you want to speak of multiple topics where there are people and you expect all of them to have or to come to terms with it. What you need to do is that you need to understand that the kind of people who come here, they have these issues and these issues and these issues. So you try to screen and to put people with similar issues together so that you can take them through in a similar way. So allowing the freedom to leave the group also is an ethical way. You can allow them to leave the group. Monitoring confidentiality among group members. When you bring people together, or the group, the counselors comes in the group setup, you need also to monitor confidentiality, because in order for someone to express themselves, they need to be assured of confidentiality. And you also, as someone who is leading this group, you need to tell them that confidentiality is key, and if there is any member within the group who will break that confidentiality of members, you make sure there is some form of either you chase them away or you come up with a way on how to deal with that issue, so that the other members will be comfortable in the group and they will be comfortable to share their issues that they are going through. Guarding against group members' manipulation or abusing each other. You, as the group leader, you are supposed to guard against group members manipulating or abusing each other. Then there's the group experience or group formation. This is when the institution recognizes a need to form a group. Maybe you are in a certain institution and that institution says that or feels that we need to have a group talk or group counseling on certain group of people. So the institution recognizes a need to form a group. Then the leaders then announces, then advertise the time, place and purpose of the group formation, and there is the need to identify the number of group members, the type and age group of the participants. Every time you go to a group meeting or you want to set up a group meeting, you need to identify the number of group members that are there. Then what type is it? Is it the young generation? Is it the old generation? Is it the mixed generation? Is it people with similar issues or people with diverse issues? So the type, and then the age group of the people. What age are you going to to handle. When we talk about age groups, so this is to make sure that when you go there, when you go and meet that particular group, you understand their language, you understand them, you understand the dynamics that they face within that particular group of the participants. So then there is the screening of group members. Screening is necessary for ethical and professional reasons. Screening is where you sort out, you place them appropriately, you make sure that you have the right group for the right people. Screening can be through questionnaires or interviews. You can have questionnaires with them, you can have interviews with them so that you can place them where they are supposed to be. A pre-group session can be used as both a screening and an informational procedure. A pre-group session is where you bring all the group together, then you talk to them, maybe you give them guidelines, you show them that, or you come up with an agreement on certain dates that you will be meeting a particular group. Let's look at the composition of groups. Grouping should be with similar concerns and purposes. When you place people into groups, you place people with similar concerns and people who have common purposes, or there is a common purpose that you want this particular group to achieve. Group composition facilitates a working bond and a more cohesive group relationship. According to Hutchinson, it L2003. Group composition facilitates a working bond and more cohesive group relationship. When you bring these people together, people with similar issues, and then you brainstorm together the dynamics that they are going through, there is more likelihood of these people bonding together and having a more cohesive group relationship. You find them maybe referring each other as comrades, referring each other because they understand one another, and they even feel that my fellow here is going through the same thing that I'm going through, and then they can also help each other to work out on their issues. It can be exclusive to men and women, abused spouses, spousal abusers, substance abuse clients, etc. So at times, especially when you bring men and women together in the group setup in certain issues, at times you find that there is a certain type of people who will not want to share out or to iron out their issues because they may feel inferior. So at times it also calls for you maybe selecting men and men, women and women, because of sharing. People do share, but there is a time when you are talking about, maybe it's about spousal or family issues, you can bring couples together. Frequency and duration of sessions. It can be 2 sessions in a week, each going for about 2 hours. So I want us to take note here that in the one-on-one counseling, in most cases it goes between 45 minutes to 1 hour. It's only during the first day when you are taking the report, when the client has come for the first time, it's only the first day in the one-on-one counseling where you can go for sometimes, because it's the client speaking, it's the client talking, it's the client addressing their issues, the issues that they are going through. And the first day they talk and talk and talk. Yours is to use the attending skills, that is the listening, the probing, the questioning. You want to be sure on what issues are being brought here and what are we going, or what are the stages that we are going to take through and how long. But after that, the following sessions will be from 45 minutes to maximum of 1 hour. But for the group counseling normally goes for about 2 hours. In university settings, it's between 10 to 14 weeks, which is the length of a semester. In most cases, that is the time that you can have these group sessions. So that is the frequency and durations of group settings. And you need also to have sub-leaders who will be taking people through. So co-leaders, you need to have co-leaders. Co-leaders are helpful since they help group counselors in bringing in closer relationship. These are people that you choose within the group, those who will be maybe making sure that the group is composed in time. Maybe they will be making sure that everybody comes to the meeting. They also help you in some things here and there. They can share notes of what they observed, key points brought out, and emotional responses. They support group counselors, thus lessening their burden and avoiding burnout. Group stages in group counseling. The first one is initial exploratory stage. Initial exploratory stage. In this stage, the group counselor responds to the group as a whole to foster group feelings. Here, in initial exploratory stage is where the counselor responds to the group as a whole to foster those feelings. It helps members socialize and know each other deeply. Members discuss and set goals as a group and help members develop skills and attitudes that will foster group cohesion according to Nugent 2009, page 157. Then the second stage is the transition stage. Members begin to realize or are confronted with the need to explore more deeply, to self-disclosure more intensively, and to interact more with other group members, according to Nugent 2009, page 158. In this transition stage, counselors help group members to be aware of their anger or negative feelings. The members are also regulated to be respectful to each other and learn how to handle their frustrations maturely. So the transition stage is where, after they have explored their issues, everybody have spoken what they are going through, what the issue is all about, and now you've come to this transition stage. This is now where each member is now becoming specific, and they are trying each to handle their things or to speak out on what they are going through. And at times, anger arises here because when you deal or when you people are talking about a certain thing, someone might rise up and feel that you don't understand what they are going through, you are not getting them. And here is where now you, as a counselor, you need now to come up with strategies on how to make sure that nobody hurts the other person. The members are also regulated to be respectful to each other and learn how to handle their frustrations maturely. There are two stages here: storming and norming. In this stage, transition stage, there is the storming and norming. Storming is the stage where members bring out their hostilities, including resentments. They come out with hostilities, including resentment. For example, maybe you are having a group of men, of people who have been abused in a relationship, and they are here, and you find that maybe, for example, a woman is there who was in a relationship or is in an abusive relationship, and then she comes up with a word and says, all men are dogs. And then you find there is a man there who rises up wanting to confront this issue, and that man also wants to say that all women are the same. So here is the stage where members bring out their hostilities, including resentments. And norming is that where members personally identity to group identity. Members' personal identity to group identity. This is where now the member feels that I am in this group and this is where I am supposed to be. So it is where the members' this is the members' personal identity to group identity. They identify themselves with that group. Then the third stage is the working stage. Working stage is where members are able to interact closely. Members take risk of sharing deep emotional feelings and attitudes without fear or rejection. This is where now people have opened up They have realized that this is the group I am supposed to be. They have realized that in this group I am respected, and in this group there is confidentiality. I'm free to share, and whatever I share here, I am confident that it will not go beyond this place, and therefore they express deep emotional feelings. At this stage, members can even confront each other in order to support a person to move from the area of stagnation. This is where they can identify themselves that there is someone here who is not yet able to move from where they are to the next level, and they feel like they need to help this person to move to go together with them. They become less dependent on the leader at this point. This is where, before even the leader comes, you find that they have already spoken up, they have already shared, and they are moving on together. They are willing to change to new behaviors and give positive feedback on their experiences. And they are willing to make new changes in their lifestyles and are excited about their change of behavior. So here in this working stage is where people are now happy, they are able to work on their behaviors, they are able even to come up with strategies on how they are going to move on to the next level. There is intimacy and cohesiveness in this stage. Then there is the fourth stage, which is the last stage here, is consolidation and termination. It is the last stage in group counseling. It is time for summarizing, pulling together loose ends, and integrating and interpreting the group experience according to Nugent 2009, page 160. So this is a time for summarizing, pulling up together the issues, making out summaries on what has been going on, and remember in the first time when the members came, you had a time to brainstorm together and setting out goals. So here is where you now try to look at whether the goals have been met, with the expectations have been met. This is now where everybody feels that they have been assisted, they feel that they have shared their issues, and they feel that this is now, we are now okay, we can now go on. So here is where you either terminate or you do some referrals. Maybe within the group discussions, there are people who need some specialized treatment, so you refer them appropriately. In counseling, you are one of the, and we talked this when we were talking about the skills in counseling. There is a skill called referral. Referral is where you feel that you are not competent enough with the issue that the client is going on through, or maybe the kind of a thing that client is going through is not counseling per se. Maybe it needs some medication, or someone else, or a more professionalist person more than you refer that person. In counseling, you don't struggle with somebody, you don't push yourself, you don't force yourself dealing with issues that you can't handle. If you feel that you cannot handle this one, or you are insufficient enough to deal with this issue, you refer that person appropriately where they can get assistance. So here in consolidation and termination is where it is appropriate to prepare the group about the termination 3 sessions before the termination date. Before you terminate, you tell them, now in the next the following session, or the 2 sessions coming, we are going to have 2 sessions, then we terminate our discussions. Discussions should be done concerning the actual feelings of sadness, loss, etc., which members feel for separation from each other. You need to prepare them, because when you terminate suddenly and people had already become bond together, and then you tell them that we are ending our group today, you may find these people having another issues altogether. So you need to prepare them so that they may start feeling that we are going to end the program, we are going to end this discussion, this meeting, and then they prepare now leaving each other. It also sometimes becomes difficult even for the counselor, because you had already interacted with these people, you had identified maybe yourself with this group, they had loved you, you had loved them, and you are moving together, and then you come to an end. So members need to share feelings about significant others outside the group and emotions that they are struggling with. And that was all about group discussion. Now, we want now to focus on counseling stages. Or the stages involved in counseling. And we are going to begin from the very first stage. Now, when we talk of counseling stages, this is when you have already you have already done the contraction. Contraction is that agreement where the client and the counselor comes to an agreement of working together in these therapeutic sessions. So this is where the client comes to the counselor, and basically we never go to the clients. Counselors never goes to the clients, they never go to look for clients. You don't go to where people are and you tell them, I'm here, I'm a counselor, I'm looking for someone with issues, I want to deal with you. Even when you feel or when you see people going or struggling with issues, we don't go and tell them, come to me, I will counsel you. No, you wait until they feel that they need a counselor, or when they are referred to you. So that is where counseling begins. When they come there, you start a process of contraction where you have some form where you come to an agreement on how you are going to do this counseling, who is going to be the counselor, and you give them the expectations for you as a counselor and their expectations as counselee during this entire sessions, and the amount to be paid, because we are talking of professional counseling where there is payment, there is it's not a free service unless when you have decided to do a pro bono. A pro bono is the services rendered to a client without any payment. But we are talking about professionalism, and in professionalism there is some money involvement, where they come there and they also pay for the services. The counseling process, stage one, initial disclosure, relationship or building. This is now after the client has come, they have registered or they have contracted, and now they have now entered, or they have come now to the sessions. So stage one is the initial disclosure or relationship building or making rapport. The counseling process begins with relationship building. This stage focuses on the counselor engaging with the client to explore the issues that directly affect them. So here is where the client is speaking. You ask them, you have come to the session, you have come today. What brings you today? So the client speaks and speaks and speaks, and during that time, according to the skills that you are going to use, the skills that you are given, the attending skills, the client feels that, and after you have assured them of confidentiality, the client feels that I need to share more, this person understands me, this person, you know, the skills that we talked about, especially when you are with the client here and there. The skills that you employ here, empathy. Empathy is where the client feels that I am in the right place and this person understands me without judgmental. And empathy is not sympathy, and you don't sympathize with the client. Empathy is where you feel with them. there is the congruent. This is where the client feels that actually the counselor is here with me. You remember there's the probing where you want to understand more. You at times you summarize, you pause and summarize a little bit to catch up with the client. You tell them, kindly, just a minute, let me get clarity on what you have just said. I want to make sure that I understand you clearly. Is it true that you've said this and this and this? Am I clear with you? Am I together with you? Have I gotten what you are saying? So that we move together in the same page so that I don't miss anything. And the client say, yes, you've gotten me. Then you encourage them also to continue telling the story. It is their story. It is their issue. Let them speak out. It is not your issue, it is their issue. You just relax. So in this stage focuses on the counselor engaging with the client to explore the issues that directly affect them. The vital first interview can set the sense for what is to come, with the client reading the counselor's verbal and nonverbal signals to draw inferences about the counselor and the process. So when the client is speaking out, when they are talking of their issues, and you as a counselor, you are there, this is now when the client will also read verbal and non-verbal issues or clues in the counselor. At times you may find that the counselor or the client is speaking, the client is talking their issues out, and the counselor is looking at the watch. What does that signify when you look at the watch? You are telling this person that you have spoken a lot, you need to stop, I am bored with you, we need to end this session, we need to terminate. Or the client is looking at you when they are talking, and it's like you are frowning on what they are telling you. Or you are crying, you are shedding tears, or you are saying, So the client feels like they have talked too much to you, or maybe you are overwhelmed with what they are saying, and they feel unsafe because the counselor, is overwhelmed. It doesn't matter whatever the client says in the session. What matters here is the preparedness of the counselor and the employing of the skills. Also, you need to be careful on how you employ the skills that you are given. Remember, we say that when you are with the client and you are sitting and you are crossing your legs, the client feels that here I'm not wanted. This person is blocking me, and therefore it's like, or you are closing your hands and you are with the client. We talk of opening when you are sitting with them. Remember the shoveler? We say the sitting positions. You sit upright, facing the client, or somehow adjacently when with the client, because the reason as to why we are sitting adjacently is maybe when somebody is speaking and there is a bad odor coming out of their mouth, they feel uncomfortable speaking to you. Or maybe the way they have dressed and they don't want to face you, or maybe there's something that they don't want closely you to face them. So in most cases, you put your seat slightly adjacent, facing each other, so that the client may be comfortable with the counselor. So it is not where you see a client may be speaking and you are moving closer, and the client is looking like they are reading this non-verbal communication and they're saying, why is this person trying to interfere, especially when it is an opposite gender who is here from the counselor, who have come here, and maybe they have pushed their chair far away and you are coming closer to them, and actually you are coming closer and closer. It's like you want to touch them. They are reading those non-verbal communications or signals. So the vital first stage interview can set the scene for what is to come, with the client reading the counselor's verbal and non-verbal signals to draw inferences about the counselor and the process. The counselor focuses on using good listening skills and building a positive relationship. When successful, it ensures a strong foundation for future dialogue and the continuing counseling process. Then we go to the second stage. This is in-depth exploration or problem assessment. in-depth exploration of problem assessment. While the counselor and client continue to build a beneficial, collaborative relationship, another process is underway: problem assessment. The counselor carefully listens and draws out information regarding the client's situation. That is, the counselor carefully listens and draws out information regarding the client's situations, such as life, their work, their home, education, etc. And the reason they have engaged in counseling, the reason as to why they have come for the session, for the counseling, why have they brought them here? Information crucial to subsequent stages of counseling includes identifying triggers. So when they come here, when they have spoken their issues out, here now is where now the counselor carefully tries to look at the triggers. What triggers this individual or this pattern in the individual? What triggers this issue in the life of this person? The timing. This is where you now identify, after the client have given out the issues, you as a counselor, you are now able to know the number of sessions that you are going to go with this client. So the timing, environmental factors, the stress levels, and other contributing factors. So there is no standard amount of, there's no standard duration that is set for every counseling. It is upon you, the counselor, after hearing the issues, it is upon you now to set up the timing, the duration that you are going to deal with this particular client. So I know at times we are told, we talked of last time, and you say that it is not a lifetime engagement with the client. It is not a lifetime engagement. We say that it is a time, you have sessions with this client, and after a particular moment you terminate. There is that point of termination. Then stage 3 is commitment to action or goal setting. Goal setting. Effective counseling relies on setting appropriate and realistic goals. Appropriate and realistic goals, building on the previous stages. So you set appropriate goals, realistic goals, building on the previous stages. The goals must be identified and developed collaboratively, with the client committing to a set of steps leading to a particular outcome. So here, you set these goals collaboratively with the client. It is you and the client who are setting these goals, what they need to achieve at the end of the sessions, or why they came here, what are the expectations that they need to have at the end of the sessions, at the end of the counseling. What will they want to have achieved? So with the client committing to a set of steps, the client also needs to commit themselves that it is upon them, that you need also to tell them that in order for you to be assisted in this session, it all depends on the level of openness. It also depends on you as individuals taking these particular steps. Let them know that it is not upon the counselor, but upon them as the client. Then we go to the 4th stage, that is the counseling intervention. Counseling intervention. This stage varies depending on the counselor and the theories they are familiar with, as well as the situation the client faces. So this is where it depends now on you. What kind of a theory are you using? Which type of theory are you taking this client through? Is it the CBT, cognitive behavioral theory? Are you using the humanistic theory? Is it the developmental? What stage? What theory are you? Depending on the theories, and also you always take the theory that you are very much familiar with. For example, a behavioral approach may suggest engaging in activities designed to help the client alter their behavior. Maybe the issue that you are handling here is about the behavior of this particular individual. So the theory that you are going to use, the way that you are going to, the way you are going to design to help the client alter their behavior. We say that in the behavioral theory, we say that behaviors are learned, and there are behaviors that you can unlearn. So behaviors are learned and unlearned and relearned. So in comparison, a person-centered approach seeks to engage the client's self-actualization tendency. So if you are using a person-centered approach, here you now seek to engage the client's self-actualization tendency. You will now sit with them and you want to know how much do they know about themselves? How do they know the issues that they are going through themselves? So here is where you let them do the check. Like for example, the SMART goals, the SWOT analysis, where they look at their strengths, on their weaknesses, the opportunities and the threats that they have. So this is where you run a SWOT analysis with them, where you do the SMART goal settings with them, where they look at the issue specific. Is it measurable? Is it attainable? Is it realistic? Is it within a certain time bound? You sit down with them and you take them through that one. Then this leads us to the last stage, stage 5, evaluation, termination, or referral. Termination may not seem like a stage, but the art of ending the counseling is critical. The way you end that session matters a lot, and the client needs to be prepared early in advance. 2 stages prior to termination, you need to tell them that we are going to have another stage, and then after that stage, I feel that we will be good to terminate. And you ask them, well, how do you feel? Unless within the sessions that you are going through, you find that you are dealing, yes, with this issue, but you find that there is also an emerging issue that need to be addressed. So before you end or you terminate, you may tell them that I feel that there is something else that we have not tackled, and I feel that we need to continue with this. So you also seek consent from the client. But the moment you find that it is time to terminate, you make them get ready, get prepared. But that art also of ending the counseling is very critical, because you may end up having other issues. Drawing counseling to a close must be planned well in advance to ensure a positive conclusion is reached while avoiding anger, sadness, or anxiety. So this is according to Kiadaki and Strauss 2012. So drawing counseling to a close must be planned well in advance. From the day you contracted with this client, you tell them that we are going to go for 6 sessions or 5 sessions or 3 sessions. So you keep on reminding them that we have done 2 sessions, we are remaining with 3 sessions. You need to make sure that they understand that you are about to terminate. You make it conclusively, so that maybe there is and we also say that you need to be careful that you don't develop that dependency from the client, that the client does not depend so much on you, so that when it comes to the time of termination, they need to realize that it is upon them, and now that they have acquired enough skills for them to handle their issues. So you need to be careful, plan it well in advance to ensure a positive conclusion is reached, while avoiding that anger, that sadness, that anxiety that may come with it. Part of the process is to reach an early agreement on how the therapy will end and what success looks like. This may lead to a referral if required. So if you've come to the end and the client feels that I have not been helped at all, there is nothing that I've gotten from here, so you now consider telling them now, since we have gone through these sessions, and it's like you have not been assisted, you've not been helped here, do you mind if I can refer you to someone else, to some other places, so you make sure that the client understands that you are not the final, they can also be referred somewhere else. While there are clear stages to the typical counseling process, other than termination, each may be ongoing. For example, while setting goals, new information or understanding may surface that requires additional assessment of the problem. So when you are with the client, you had already agreed that we are going for 6 sessions. And when you are towards the 6 sessions, you find that there are other emerging issues with the client and that you are not going to, the 6 sessions are not going to be adequate enough. You tell them early in advance that I feel we had contracted for 6 contracts and 6 sessions, and now I feel that we need to add more because there is these emerging issues that we need also to deal with. So you also prepare them. Steps in the counseling process. Many crucial steps go together to form the 5 stages of the counseling process that we have just said. How well they are performed can affect the success of each stage and overall outcome of counseling according to Krishna ND. So key stages for the client. The client must take the following 4 steps for counseling to be successful according to Krishna ND. 1. Willingness. Being willing to seek and attend counseling is a crucial step for any individual. So when the client comes during the contraction, you need to know that they are willing to come here. They have not been coerced. And if they are willing to come to the sessions, you ask them, tell me, when do you think you are available? What days are appropriate to you? So you come up and setting up days that they will be coming, time that they will be available. So being willing to seek and attend counseling is a crucial step for any individual. It involves the recognition that they need to make changes and require help to do so. So they need to recognize that it is upon them that they need to make changes and they require help to do so. Taking the next action often involves overcoming the anxiety of moving out of the comfort zone and engaging in new thinking patterns and behaviors. So this is the work of the counselor, where you are with this person and you need to make sure that they come to the next action, which often involves overcoming the anxiety of moving out of the comfort zone. Many people are many people are comfortable on the issues that they are going through, and they don't feel that they can make a change in their lives. There are those who come to you and they feel that they don't have any problem because people have told them to come to counseling. There are those who come there, yes, they have that consciousness of changing, but they feel like they don't have the energy to do it. So this is now the work of the counselor, to move with them from level to level until they feel that they can now come out of their comfort zone. Then the second step is motivation. Being willing to make changes and engage in them involves maintaining and sustaining motivation. It is like a child when they are preparing to make the first step in walking. You find that the caregiver, the caretaker, or the mother, for instance, who is taking care of the child, they normally motivate them, they entice them, they when the child makes a step, you find that they encourage them. So here, you being willing to make changes and engage in them involve maintaining and sustaining motivation. Without it, the counseling process will falter when the real work begins. This means that when this person have tried, maybe it was about changing something in their lives, and they have come here and they say, maybe, let's say for example, it's about smoking, and this person has come here because they want to quit smoking. You see, there are things, or in counseling, we don't tell people to stop this thing at a go. It is a process, it is a step by step. So maybe they were taking 5 cigarettes a day, and now they come and say, no, you know what, yesterday, or since we left last time, I used to smoke 5 cigarettes a day, and now I find that I'm smoking 4. I have left 1. You need to encourage them and tell them, congratulations, you are moving towards the right direction. So when you motivate them, whatever gets motivated, it gets done. Then the third stage is commitment. The client may be willing and motivated, but changes will not happen without continued patience and commitment. Commitment may be a series of repeating decisions to persist and move forward. This commitment is where this person is committed to the change. If you find that somebody comes early, they come to the sessions as agreed, they are committed to whatever you are talking about, and they are willing, even if they are motivated and they are not committed, it may also not work. The last step here is faith. Faith. Counseling is unlikely to succeed unless the client has faith in themselves, they have faith in the counselor, and they have faith in the process. Taking the step to begin and continue with counseling requires the belief that it can be successful. So this person, the client who has come here, they need to believe that it is workable. They need to believe that I will be assisted. They need to believe that I will make it. So they need to have faith. We have key steps for the counselor. Now this is now for the counselor when dealing with the client. Each step in the counseling process is vital to forming and maintaining an effective counselor-client relationship. Together, they support what Carl Rogers, 1957, describes as the core conditions for successful therapy. So this is what Carl Rogers said. 1, he gave us unconditional positive regard, UPR. Unconditional positive regard. Unconditional positive regard, as we said last time when we were talking about counseling skills, is that part where you accept the client regardless of their positions, regardless of who they are, regardless of what they are, regardless of what they are going through. It is only a counselor who understands everybody. The client comes here who have been beaten by the world, who have been abused. The client come here and the client has been abused even by a social group, but it's only the counselor who will accept them. So you give them that unconditional positive regard. Through acceptance and non-judgmental behavior, the therapist makes space for the needs of the client and treats them with dignity. Here, UPR is where you treat them with dignity. You give them that, let them feel that here they are wanted. Where they come from, nobody listens to them, but here you give them that listening ear where they speak and speak volumes of words, and you are there encouraging them and showing them that it is well. Number 2, empathy. Empathy. The counselor shows genuine understanding even if they disagree with the client. You show them genuine understanding even if they disagree with the client. The client has come, there are issues they are going through, you don't understand with the values that they have, you don't understand with what they are saying, or you are not in agreement with them, but you show them genuine understanding. And it is always very bad and very unprofessional for you as a counselor when the client speaks of what they are going through and you tell them, I know, I understand. You will never understand. You will never know what they are going through. Even if you come through a similar experience, experiences are different and in different levels. So never use the words like I know, I understand. Never use such words. So empathy is the showing genuine understanding even if they disagree with the client. Then the third thing is congruence. Congruence are the words, feelings, and actions of the counselor embody consistency. Words, feelings, and actions of the counselor embody consistency. Congruence is where you are with this person and you listen to them, you are very keen on whatever they go through. Counselors often help clients make important and emotional decisions in their lives. To form empathy, they must intimately take part in the client's inner realm or inscape. You always make them make important decisions, and in helping them make important decisions is that you give them multiple of information and you show them that yes, it is possible, it can be done, and then they make informed decisions based on what the counselor has taken them through. Several well-performed steps can help the counselor engage with the client and ensure they listen openly. Without judgment or expectation, the counselor must work on the following measures to build and maintain the relationship with the client according to Krishnan ND. 1. Introduce themselves clearly and with warmth. So this is where now or how you welcome the client. When the client comes, number one, you introduce them clearly and with warmth. A client has come to your sessions or he has come to you as a counselor and they need your services. When they appear, they enter into your room. The way you welcome them, the way you address them, learn to know them, know their name so that you will be addressing them by their name, and also use the appropriate name that they like. Even during the construction, there is a place where they write their name. You need to be very keen on how they address themselves. If they address themselves as Mr. So and so, every time you talk with them or every time you refer to them, you refer them as Mr. So and so according to the way they like to be introduced. So introduce them. So when you also introduce yourself to the client, you need to introduce yourself with a lot of warmth, show them concern, show them that they are in the right place, that you are here for them. So you introduce themselves clearly and with warmth. Number 2, invite the client to take a seat. When the client comes, let them not find you sitting and you tell them, sit. You don't just prepare seats, or when the client comes, the seat is all over, you tell them just take a seat there and you can sit anywhere you feel like. Just welcome them, let them, invite them to take a seat. And also, when you invite to take a seat, you don't show them where they are supposed to sit. You let them choose where they are supposed to sit and which seat they are supposed. In that matter, we need also to have seats that looks alike, seats that are similar, either in color, either in the way they are made, so that the client may not feel that this one, it looks more sophisticated and therefore it is for the counselor, and this other one, which is lesser than me, which is lesser than the other one, this one I'm supposed to sit on it. No, let them feel that nobody is greater here. It is client-led. Address the client by the name they are most comfortable with. The name that they are most comfortable with. Engage in relaxed social conversation to reduce anxiety. Pay attention to nonverbal communication to identify the client's emotional state. We said that in the nonverbal communication, a client may say something, but when you judge from what they are saying and how their facial expression shows, it is like two total different things. For example, if somebody say that I killed that person and they are smiling, so you need to have something to confront. You tell them later, tell me, When you are talking about how you killed that person, you smiled. What could be the thing that made you to smile in killing someone? So at times, the nonverbal speaks volumes more than what is being said. So you pay attention to nonverbal communication. Then invite the client using open questions to explain their reason for coming to counseling. You don't tell them, why did you come to counseling? That is a closed-ended question. When you want them to speak more, you tell them, yes, it is good, you've come to counseling, maybe you've had us, would you mind to tell me more as to why you have decided to come to counseling? How did you get to know us? Where did you learn about us? And what brought you here today? So they will speak and speak until when they feel that they have explored everything that they had. Allow the client time to answer fully without pressure. You allow them to speak without pressure, without forcing them. At times, you may ask a client something and they take time. Maybe they are composing themselves on how they are going to speak, and you are there forcing them, speak now. Why are you quiet? Why are you not saying anything? Allow them time to answer. And once they have spoken, let them finish what they are saying. Even if they speak slowly and you feel like you need to finish the wordings, pengine ni mtu anaongea pole pole na unaona I need to finish this one amalize. No, just let them finish what they want to say. Show that they are interested in the client as a person. You show them that you are interested in them as a person. Each of the above steps is important. Taken together, they can facilitate the formation of a valuable counseling relationship. Ultimately, counseling is collaborative and requires a series of ongoing steps, some taken by the client, others by the counselor, and several jointly. For a successful outcome, appropriate resources, time and focus must be given to each one, and every win must be recognized and used to support the next. So let's look at valuable skills for each phase. Good communication is vital to all stages of counseling. Skills should ideally include, according to Krishna ND, Lesley University ND, American Psychological Association 2008. These skills include active listening techniques. Active listening techniques. So in the active listening techniques, we have clarification, reflection, effective questioning. Clarification is where words were spoken and maybe you want them to be clarified so that you may understand them clearly. Reflection is where you give the client an opportunity to reflect back on what they have just said and what they meant on certain issues and whether they are ready for the change. Then effective questioning is when the client have said something and you didn't understand, then you ask that particular question and the client feels that you've asked actually, even in questioning, we also need to have some manners. For example, a girl who has been defiled or raped has come and they are speaking on how they were molested and defiled, and you are there as a counselor and you tell them you want the girl to narrate the process on how it was being done. So effective questioning. You ask the right question, appropriate question, questions that are relevant. You ask relevant, and relevancy is required here. Beyond that, to build rapport with the client, counselors must also One, be able to experience and show empathy rather than sympathy. You show empathy. See things from the client's perspective. You see things from the client's perspective. Have a genuine interest in others' well-being. You have a genuine interest on them. Use self-reflection to observe themselves and emphasize with others. Empathize with others. Use self-reflection to observe themselves and then empathize with others. Show accessibility and authenticity during counseling sessions. You show accessibility and authenticity during counseling sessions. This one, it means that when let the client feels that you are accessible, you can be found, you can be asked anything, and you are there as you will answer them appropriately without judgmental. So here is where you avoid being judgmental. You avoid telling them that you need to have done this, or maybe they have come there and they are expressing themselves on the, for example, on the issues of rape that I was wearing. I had put on my clothes and I met people and they were saying that it is too short, and then you tell them you are raped because of the way you you behave yourself. No, you avoid being judgmental, so you show them accessibility. You see, at times they can ask a silly question and you tell them, how can you ask me such a silly question? No, you just show accessibility. Be flexible in their views and thinking regarding different values and multicultural issues. Be flexible in their views and thinking regarding differing values and multicultural issues. They can come to you and they have a different view from you. You don't, yani awakemei, you be flexible in their views. You accept the views, the way they they see things, the cultures that they come from. You don't tell them that that you are doing is wrong. For example, you are in a session with someone on LGBT who is in the LGBTQI, where they are there, they have come, the way they have dressed, they have dressed, the way they have made their hair. Maybe it's a man and they have come there, they have pleated their hair, they applied makeups, and you are telling them, why are you like a woman? Why are you behaving like this? You can be sued for so you need also to be flexible in their views and thinking regarding differing values and multicultural issues. Be able to maintain a sense of humor. Don't be rigid. And also in humor, don't laugh in everything. They don't tell you what they have gone through and then you are laughing. And there are issues that does not need to be laughed at. But you need to be moderate on how you maintain a sense of humor. Be resilient and able to bounce back from difficult situations. You are there, they have come with issues that you had gone through. You don't have to identify with those issues. You don't have to tell them, hey, this same thing, I have been going through this, now tell me. You see, there's a time when a client can come to you and they bring out hard issues that you are going through, then you now you now start crying and you feel like now the client ndiye sasa anaanza kukucancel, anaanza kuambia, oh, I'm sorry, you can make it, you can go through this. So be resilient. Resilience is that aspect where you are able to bounce back, to come back from the difficult situations. You are able to move on again. A mental health practitioner delivering positive outcomes in increasingly diverse populations benefits from developing theory, knowledge, and skills. So we started by defining the group counseling or group therapy or group work. It is essential to remember that group therapy is not the same as individual therapy performed within a group setting. It has specific and dedicated techniques and an additional skill set. Unfortunately, or however, training has not always kept up with the specialist needs of group therapy, according to Novotny 2019. There are other unique considerations and processes involved when offering and running group therapy, including being able to, according to Novotny 2019, one, to get the right fit. So you need to get the right fit. Getting the right fit, it means that you understand the client and you fix them where they are supposed. Not all clients are suitable for group therapy. They may be better placed in a one-to-one setting. High quality screening is required to ensure the fit of the individual to the group and vice versa. So before you decide that a certain individual needs to be put in a certain group, you need first of all to, as we said, you screen, and then you look on certain dynamics, and then you are convinced that this person can work best in group settings, or this issue can be dealt with in the group setting. So that is get the right fit. The group readiness questionnaire has been designed to identify the risk factors and the potential for dropout. So you can also have a questionnaire for the group work. Explain expectations up front. When with the group, you explain the expectations up front. So individuals' expectations of group therapy must be realistic. Change takes time, whether in a group or an individual setting. Also, the counselor must educate client that group therapy is not about shouting and heated exchanges. Sessions can be fun and rewarding. Then we are talking now on things that need to be considered in group settings. Build cohesion quickly. The issues being addressed can set the tone of the group and the speed at which it bonds. Grief groups, for example, often form cohesion quickly, while others can take more work and require splitting into smaller groups or pairs. So when in the group, at times you can be forced to split the groups into smaller group, so that, and mostly on those who have issue specifics, so that they can build cohesion quickly. So seek feedback. Early and regular feedback can help assess how individuals and the groups are functioning and whether dropout is likely. Then identify and address ruptures. Group work can lead to disagreements. Concerns and ruptures should be worked through early on, either bringing up issues directly with the members involved or more generally as a group. So you identify and address ruptures as early as they arise, so that you can deal with it very soon or very quickly. That was all about group work and steps that need to be taken in counseling. Thank you so much. We have come to the end of the session.